Introducing the Outcomes for Change Fund. Despite more than $13 billion in aid flowing into Haiti since 2010, millions still lack access to basic necessities like healthcare, education, and clean sanitation. Too often, funding is tied to activities rather than tangible results on the ground. The Outcomes for Change Fund is changing that. It's the first large-scale outcomes-based fund in a fragile state, designed to deliver real, measurable results that actually matter for Haitians. Built on years of learning from IDB Labs' work across Latin America, the fund brings together investors, donors, and service providers to co-fund projects that are paid based on results, not promises. To build trust and enhance transparency, all results are independently verified by a third-party firm. This rigorous process gives funders, partners, and communities greater confidence that promises are being fulfilled. In Phase 1, we launched high-impact pilot projects that are already transforming lives, from improving maternal health and sanitation to strengthening food security and climate resilience. And the results speak for themselves. We demonstrated that pay-for-results mechanisms are feasible in Haiti, even amid political and operational challenges. Showed that incentives aligned with outcomes can improve service delivery and innovation. Community engagement improved outcomes and relevance of interventions. That adaptability drive results. Flexibility in programming led to better problem-solving and responsiveness. Transparent verification boosted credibility and accountability. Reliable data enabled learning and performance management, not just payment. The multi-stakeholder collaboration fostered shared learning and ownership. And now we turn to leveraging technology and incentives to enhance last-mile health in Haiti with C2C. In Haiti, too many mothers still face pregnancy and childbirth without access to quality care. C2C's maternal health program is changing that, clinic by clinic, mother by mother. Key results from Phase 1. Prenatal care access. A total of 1,059 mothers completed at least 4 prenatal visits. This is nearly double the program's initial target. Safe births. Over the past year, 384 mothers gave birth in health facilities with trained professionals. That's 50% more than we expected, meaning more safety for both mothers and their babies. Early childhood vaccine. And over 1,200 newborns received their recommended vaccinations by age 2. Helping protect them from disease from day 1. Community trust and quality care. Every mom surveyed reported receiving the full package of care: prenatal services, testing, vaccinations, and support from trained staff. OCF collaborated with C2C to develop a reliable verification method using the clinic's existing data systems, ensuring that the data is accurate and trustworthy. The numbers speak for themselves. Outcome-based contracts help deliver better care to more mothers, babies, and families, giving them the care they deserve and the futures they hope for. And now we turn to paying for sanitation success with soil. In Cap Haitian, only 37% of people have access to improved sanitation, putting families at risk of disease and making them more vulnerable to extreme climate events. But that's beginning to change. Soil's container-based model is safely and sustainably closing the sanitation gap. Key results from Phase 1. New subscribers. In less than a year and a half, over 1,500 households have subscribed to Soil's Ecolake service, nearly double the original target. Each household now has access to a safe, dignified toilet. Service retention. 95.5% of users remain subscribed for at least 6 months. That continued trust is showing that the system is working effectively, meeting people's needs. Service reliability. Over 99% of users confirm timely waste collection. Behind the scenes, all subscriber data and payments are independently verified, making this a model of service excellence and transparency. Improved sanitation access. Soil's service led to a 15.9% increase in improved sanitation access across the 8 target regions, exceeding the original goal of 10 to 15%. Step by step, communities are becoming more resilient, surpassing expectations and transforming lives. After collection, waste is transformed into compost. Every step is tracked, tested, and verified for safety. This compost can now be sold to local farmers to grow what's next. Soil's success demonstrates that outcome-based financing works. The work has proven their capacity to deliver and is building trust between Soil, communities, and partners. The first outcomes-based project has helped Soil to enter a clear pathway toward growth and public investment. In Haiti, paying for outcomes isn't just possible, it's a reality. And now we turn to Seed to Market with the Haiti Food System Alliance. Phase 1 of the Seed to Market project is currently underway with the Haiti Food System Alliance. This initiative marks Haiti's first large-scale pilot in agroforestry and sustainable agriculture, aiming to support over 1,000 smallholder farmers. The goal is to boost food security for vulnerable families and strengthen the resilience of local supply chains. With verification protocols recently approved by all stakeholders, farmers are already making an impact, growing nourishing food and building more resilient local supply chains. Through these supply chains, farmers can produce with confidence, knowing they have guaranteed market demand and fixed pricing. Thanks to partners like Food for the Poor and buyers committed to advance purchasing agreements, families are now able to plan ahead with greater security and hope for the future. This pilot is projected to increase yields for crops like peanuts, beans, and maize across more than 1,000 farms. It will improve soil health on hundreds of farms and introduce agroforestry practices that restore degraded land. With nearly 2/3 of the budget already covered by crop sales and pre-purchase agreements, Seed to Market sets a new standard for sustainability, accountability, and resilience in Haiti's food systems. And now as we look to the future, vibrant schools, transforming education through student-centered learning. Coming soon, the Outcomes for Change Fund is partnering with Blue Butterfly, the Model School Network, and others to launch Vibrant Schools, our first outcomes-based education project. This initiative will deliver student-centered content and creative teaching tools to the schools that need them most. We're not just measuring attendance, we're focusing on what truly matters: better teaching, more engaged students, and schools that remain resilient, even during crises. It's all about empowering teachers to teach better and helping students thrive. This is not just a fund, it's a movement to make aid more accountable and more effective where it matters most. And it's powered by a growing community of co-funders, partners, investors, implementers, and changemakers, working together to rewrite the story of development in Haiti. Join us to transform how development is done here. Are you in?